One of the grand opportunities presented by the World Economic Forum Summit is networking, and the opportunity to meet African leaders, to meet people from various geographies and sectors, and especially to engage African government representatives is going to really be valuable. Really looking forward to being able to make a contribution and to listen and hear what other leaders have to say about this issue. Obviously, our company is very engineering and technology oriented, and at first blush it's not immediately apparent that this set of skills would be translatable to malaria. But we have found out that one of the major needs in the area of malaria is a business discipline, a business mindset, as well as skills and capabilities that businesses such as ours typically bring, such as project management, project planning, financial controls. These are highly welcome in the field of malaria control. And one of the major executives in Rollback Malaria even mentioned on understanding the business competencies and the business value add in the malaria equation, that what the world needs is more malaria engineers. So fundamentally, ExxonMobil's role as a multinational and major operator in Africa, as well as the larger private sector role in all of Africa, can bring tremendous benefits in terms of capabilities and core competencies that businesses can bring to add value to the fight against malaria. ExxonMobil embarked on the malaria battle in 2000, 7 years ago, because we came to recognize that the mosquito doesn't respect fence lines and that our employees and families are very much a part of the community. 87 to 90% of our employees are African nationals. They go home to the communities every night, as do the rest of our employees. And we have our fate and economic welfare very much tied up with the community. And it was a very, very easy business case to make for ExxonMobil to get invested in malaria in a very significant way, especially in the areas around our operations where we can make the greatest contribution. There's a giant humanitarian case. And again, the thing about malaria is that it pulls together the humanitarian case, the business case, and also the results case, which is that at the end of the day, we have the greatest opportunity in 50 years working together. Malaria has been the most neglected of neglected diseases over the last 50 years, and frankly, very little progress has been made across the African continent. It's only since 2000, and since the Abuja Declaration, led by President Obasanjo of Nigeria and signed by about 50 heads of state, that malaria hit the radar screen as a big issue and had the right leadership and political will around it. And that's when ExxonMobil decided to devote significant resources in a formal initiative that we call the Africa Health Initiative to help join the fight.